Hi everyone. This research is partially funded by a SAGES Smart Enhanced Recovery Grant and a Merck Investor-Initiated Study Grant. And I'm going to start with some background. Postoperative recovery is the period between surgery and the patient's return to baseline level of health and function. And in the last 2 decades, the field of abdominal surgery has greatly evolved thanks to numerous innovations that aim to reduce tissue trauma and optimize perioperative care. For example, obviously, minimally invasive surgery, we're at SAGES, enhanced recovery pathways, and a lot of the things we've seen here at the conference in the past couple of days. Several reviews have shown that the most common outcomes traditionally reported when comparing surgical interventions are short-term audit measures such as length of stay and complication rates. The problems with this measurement approach, though, is that they fail to reflect the complexity of the recovery process. What about symptoms, functional status, well-being? They're not patient-centered, and they also ignore what happens to patients after hospital discharge. Often patients define recovery as being able to do what they used to do in an outpatient environment. So, in accordance with value-based, patient-centered care, recent literature supports that the measurement of recovery should include the patient's voice through patient-reported outcomes, or PROs, which are reports of health coming directly from the patient without interpretation by others. And PRO measures, PROMs, generally come in the form of questionnaires. And PROMs have a lot of advantages. So they allow patients to remain the key stakeholders, they better capture the complexity of recovery, and they also provide a better idea of recovery trajectory because we can administer these questionnaires at several time points after the surgery. Our group at McGill University completed a literature review looking at current PROMs used to assess recovery after abdominal surgery, and it concluded that they have little evidence supporting their measurement properties. They're not developed according to optimal scientific standards, and they're also not derived from modern psychometric methods. And importantly, they lack evidence supporting content validity, which is the extent to which the PROM reflects all aspects of the construct it's trying to measure. In other words, is this PROM actually measuring recovery after abdominal surgery? Content validity evidence comes in the form of a conceptual framework, which is an explicit and illustrative diagram or list that defines the concept to be measured in the PROM. So in light of all of that, the goal of this project was to develop a conceptual framework portraying the health domains that are relevant to patients recovering from abdominal surgery, and it is consistent with FDA guidelines for PROM development. So I'll show you how we did it. This is an overview of the entire PROM development process, and it actually summarizes a research program that the minimally invasive surgery research team at McGill University recently initiated. I'll be focusing on phase 1, the conceptual framework, and this really answers that fundamental question: what does recovery mean to patients? And that begins by developing a hypothesized conceptual framework. This is preliminary work. This was actually published last year, and this is my visual abstract. So to just give you a quick idea, we went through all the existing PROMs that are used to assess recovery after abdominal surgery. We analyzed the content and categorized all of those questions according to ICF health domains. ICF is the International Classification of Functioning, Disability, and Health. And then we completed a Delphi study to get expert consensus regarding the relevance of these domains, and here it is. 22 health domains were deemed potentially relevant to the process. What we did with this conceptual framework, this hypothesized conceptual framework, is that we used it to inform an interview guide for qualitative interviews in the next step. And this is really the heart of it all. The whole point of this research is to bring in that patient's voice, and so we interviewed the patients. It was an international project, Canada, Japan, Italy, Brazil, and this was all to ensure that we had input from patients with different backgrounds and healthcare systems. We had a minimum targeted sample size of 30, but we did continue until thematic saturation was reached. We also had target patient quotas to ensure that recruited patients represented different demographic, clinical, and surgical characteristics. Why? Well, because we want this conceptual framework and future PROM to be broadly applicable to a heterogeneous abdominal surgery population. So if you look over there, you'll see there's different extents of surgery, open and lap, those with complications and without, etc. So we transcribed and coded all of these interviews according to the ICF It was an iterative process, and a rigorous one at that, involving many researchers, and here are the results. We accomplished the recruitment of a very diverse group of abdominal surgery patients. In fact, we ticked off all of those quotas that we had established. Thematic saturation was reached by the 12th interview. In other words, after that 12th interview, none of the other interviews revealed any new health domains to add to that framework. And here are the domains cited. So the top body functions were pain, emotional functions, energy and drive, and then there was walking, changing basic body position, carrying out daily routine. Interestingly, some domains highly endorsed in this study were not unanimously captured by previous conceptual frameworks. And this is an important gap. For example, energy and drive. Patient said, my energy since surgery is at 4 on 10, and I had no energy the days following the operation. Emotional functions too. For example, I feel like I can't control my emotions since I had the surgery. I'm feeling easily irritated. Someone said they felt powerless and vulnerable as well. Domains of recovery addressed by the hypothesized conceptual framework set by healthcare providers also missed 17 domains like emotions, wound repair, especially around the incision, sensations around the wound like burning and itching. And this just emphasizes why understanding the post-op experience from the patient's perspective is pivotal to measure recovery. So this is the conceptual framework in all of its glory. All 39 health domains are up there. Body functions on the left, activities and participation on the right. We have sleep, ingestion, defecation, more daily life stuff like dressing, walking on the right. So in conclusion, we developed a conceptual framework of recovery after abdominal surgery based on patients' perspectives. Abdominal surgery directly impacts several domains of health, and this is critical groundwork for the development of a novel PRO measure. I just want to give you a little peek into the future. This is a big project, and the next step will involve the generation of items, questions that will be based on this conceptual framework. We're going to refine those questions. We're going to form a scale for the questionnaire, keeping in mind that we're always going to have patients involved throughout the entire development process. And finally, we're going to validate this questionnaire using traditional psychometric methods. We're going to have both a paper and electronic format. And with that, I end my talk. Thank you so much.